Well, we have a health alert this morning. Whooping cough cases are nearing record levels in the United States. Infants and children are especially vulnerable. Now, whooping cough can be deadly. 1 in 3 babies younger than a year old wind up being hospitalized over it. The cough can stick around for weeks after that initial infection. And the CDC reporting more than 32,000 whooping cough cases across the country. That's 6 times more than in 2023. Experts say part of the uptick is the end of COVID-19 mitigations, returning whooping cough levels to pre-pandemic numbers. Here to talk about why this is happening and how to stay safe, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control at the University of Kansas Health System. Doctor, we certainly appreciate your insights on this. You know, so much illness seems to be flying around this time of year, but what symptoms specifically for whooping cough? How do you identify them? How do they differ from other diseases?
Yeah, you know, it is very hard. That first week or so of illness, it sounds normally like a typical respiratory viral infection. So you'll probably have some cough, you'll probably have some runny nose, but as that week or two goes on, what typically you will see is an increase in severity of the cough. By the end of those 2 weeks, you are now continuing to have a severe cough. There will be very little breathing between those coughing episodes. That's how bad those paroxysms are of cough. You can get lack of oxygen. You can even have post-tussive emesis, which is basically vomiting after coughing so much. But it is really hard to tell in the initial stages. Really what you really need to look for is that continued severe cough, even 2 weeks or 3 weeks into the illness.
Understood. And which age groups are most at risk of catching whooping cough?
Yeah, you know, just like you said, it is the very young that are most at risk of catching it and having severe disease. It is also the older patients, but in generally, we are really thinking about our youngest people, our babies. They are so easily infected and can have those severe complications at significantly higher rates than older people, even those people that are 2 years and older, 5 years and older, and especially adolescents. It is really the youngest of our population that are most at risk of those severe problems from whooping cough.
If your child is diagnosed with this or you're noticing these symptoms popping up, what are your best next steps? What should you do immediately? Is there anything at home you can do to help them out first?
No, it's really getting them to the either their physician or the urgent care or the emergency room to evaluate and see what is needed for supportive care. You know, typically we don't use antibiotics after about 3 weeks of illness. There are certain populations which we can still use antibiotics, and it's recommended 6 weeks out. But generally, after those first 3 weeks or so, antibiotics are not used. So it is vitally important to get to medical attention so that you can get that supportive care, especially if you're recognizing that your child isn't able to breathe because they are coughing so much.
Now, if we rewind the clock before we get to the symptoms, what can we do to prevent whooping cough in general? Anything to do in your home or maybe exposure to other family members?
Yeah, oh gosh, that is the best and easiest thing to do. We have so much data, so much information showing that vaccines are safe and can help prevent it. What is the problem? It's the problem that older people, adolescents and older, especially parents and grandparents, aren't caught up or up to date on their vaccination against pertussis. We have a very good, safe vaccine. It is Tdap, which has tetanus, diphtheria, and then a pertussis component as well. When we can vaccinate those around our most vulnerable, which is the very young, especially new babies and children under 2, when we can vaccinate around those populations with the parents, the grandparents, and other people who may be going around, we are going to significantly reduce the chance that those people will bring the infection into the house and infect the little ones.
Well, we always appreciate your insights and you weighing in on this important topic. Dr. Dana Hawkinson, thank you for hopping on the call.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.